Welcome to Emporia Public Schools podcast. I'm your host, Dr. Allison Anderson Harder, Superintendent. This podcast is our way to provide students, staff, parents, and community members easy access to information on a variety of topics. Once you've listened to an episode, we encourage you to use the electronic link to provide feedback or ideas about the episode to which you just listened, or to share ideas for future episodes. Today, I'm visiting with Mrs. Jennifer Arndt, Director of Health Services.
Hi, thanks for having me.
Yes, thank you for being here, Jen. Well, tell us a little bit about yourself and how you came to work for Emporia Public Schools.
Yeah, so I'm actually originally from Arizona. My husband moved out there and dragged me back to Kansas with him. So I went to nursing school over at Washburn. And then from there, I started work in the ICU at Stormont Vale. We started venturing back closer towards Emporia, and that's where my husband's family is from. So the last name is a very common last name. I realized that once I moved here. And I started working at Newman, and I started doing labor and delivery. I met one of our current school nurses, and she let me know what she was into and that she was a school nurse and what that all entailed. I was very intrigued. I started having children myself and got into kind of the school district by becoming a nurse sub. And then from there, became a school nurse. And here we are today. Now I guess I'm the director of health services.
Well, we were really lucky. KDHE had some funding during COVID, and so that's how we were able to start this. And the nurses had been asking for a director of nursing services for many years because that had been a big need. So might even talk a little bit about, it's just difficult to coordinate school nursing services because it's such a unique position and there's different needs. So you might talk a little bit about that and how we got to that point.
Yeah, absolutely. So COVID was obviously a huge bummer. We're glad we're over that big, burst of all of it, the big outbreak and the big pandemic, and now we're in the endemic stage. So when COVID all started happening, we, knew that we needed additional staff, of course. So not only was my position created, but we were also able to hire additional positions at the high school. We were able to hire an additional nurse to kind of take the burden off. We had a lot of nurses that were sharing schools. And so we're able to hire additional nurse for the preschool and also one of our elementary schools. And kind of how you were saying, the nursing field and the education system is very unique. It is kind of hard to manage that. So, when we have some of the best principals in the state, and those would be our immediate supervisors in the school setting. And so sometimes we need to go to them, but I can't ask them specific nursing questions, right? And so we would bounce off each other a lot just within the schools. But then it kind of just turned into, kind of that nurse leader aspect. And it's really nice just to kind of have one person who is kind of in charge of, okay, let's make sure we're doing this the same. Let's make sure we're getting our voices heard and we're all kind of speaking together as nurses. We need X, Y, and Z in place. And it's just something that educators just have to kind of learn to all work together. And, we don't know what we don't know. And it's really nice just to have all of the additional nursing staff, including just a nursing manager kind of on top of it to kind of keep it all together.
Yeah. Everything just funnels there and it's more that health and medical. And so you're the point person. So if you need to contact another medical expert, then you can reach out to them and then you can give that consistent information back to the school nurses.
Yeah, exactly.
Talk to us. Well, we talked a little bit about health services and how schools are staffed. We also have that health office aide that helps with school nurses. So we have our school nurses,
yes,
but also our health office aides.
Yes. So we have a total of 9 nurses, but we also have the saints of the school district, and those are our health office aides. We cannot do our jobs without them at all. So we have a health office aide at the high school, at the middle school, and at every elementary school, as well as our preschool. So, but how I'm saying they are saints, they get trained kind of just on the job training, on the fly. People are very surprised on what type of students, even in our general education setting, that have medical needs, that we have to deal with. And the fact that we have these amazing assistants to help us out, not only just manage how many office visits we get a day, especially during respiratory season, but when we're not there, the things that they are managing is absolutely amazing. They're managing type 1 diabetes students. They're managing our epileptic students. They're managing, students who have, G tubes and other medical devices that, are very private. And it's very amazing what they do. With all of our, oh my gosh, with all of our documentation and bookkeeping and just helping us keep us straight. They are a godsend for us, and we're very happy to have them in our schools. Yes.
Well, and everybody does a great job with confidentiality, and they just are so cautious and very respectful and always welcoming. No matter how many times a student has visited the office, they are always very supportive and know that there's a reason that student's there.
Yeah, they're a huge face to the school.
And then also then a lot of parent calls and making sure that those are answered, and making sure that if there's any other information, any allergies that came up during enrollment, or maybe a parent forgot to add an allergy. We had that happen one time. We didn't know. And actually, who would think that a student might be exposed to, let's see, what was it? I think it was, whether it was a cow, but it was farm day. And so, but that parent just didn't think about going to school. You might have some contact with a cow. So just making sure we have all of those pieces of information that are so important, those allergies.
What? And to your point there, I know the part of enrollment that is so long and so hard to get through, it's pretty much filling out the health history. And you have to do it every single year. That is one thing that I don't know if parents understand how important that part is for the nursing staff. So when we do get those we review every single health history every single year of every single student. So some parents think, well, I did that last year. You had their information. But then when it records to us, it says that they no longer have that illness or that medication anymore. And so we think that they don't have it anymore. So one, it increases more phone calls to the parents, honestly, because we need to verify, hey, do we not have asthma anymore? Did we grow out of it type of situation? Was it more of a reactive airway type of thing? Do we not need the medicine? But then whenever we do talk to those parents, they say, oh, no. They still have asthma. I'm bringing you their inhaler, this, that, and the other thing. I just didn't think I need to put that on there because I did last year. And we come with that a lot. And again, it just creates more phone calls and more phone calls for the parents to have to clarify for us when they already went through the whole enrollment process, So if that's something that we can really get taken away for parents to understand is how important it is to fill that out every year. I know it takes time, but it is very important because that's how we can get the information into our system, and then the appropriate people know what is going on in their classroom. So it's HIPAA, it's FERPA, only the people who need to know. But we need to let the people who need to know, and we can't let them know what we don't know.
Right.
And so sometimes, it's filled out, incomplete, or it's, we get the answers of I'll call the nurse. If you can just fill that out as much as you can to the most complete you can, it's going to help every end, keep everyone just healthy and safe too.
Well, and it's easy for parents to, I think we do a great job of making sure that every parent feels welcome and very homey. And so sometimes that parent might think that their child is really the only one dealing with that situation, but they don't realize that nurses and health office aide are going through every single, just like you said, every single student record and looking for changes, and also just reminding from students that have been there for a number of years.
Correct. Yep.
So always good to help understand that and making sure that you
just
have
understand
that
the why
information. So those are just the typical day-to-day. What about medical emergencies, things that pop up that you weren't expecting?
Oh man, there's some years where I say, I'm a mental health nurse. This year was hard on mental health. And then there's some years where I'm like, wow, I was an ortho nurse this entire year. I had so many limbs going on, or just head injuries or this, that, and the other thing. So allergic reactions. So I say it varies year to year. Our biggest goal is that we are prepared for every emergency that could happen in our schools, so we're not just reactionary. And that's one of our biggest goals as nursing staff this year. It's nice, again, having my position now. I feel like our meetings are they're more effective, they're more efficient. We talk as a group, and we're able to kind of get a common goal for nursing staff. So we're not just on our own island in our own schools. So last school year, I feel like our biggest thing that we worked on was getting all of our supplies in, getting what we needed in place. And then when we started meeting as a group at the end of last school year, we were talking, we were saying, this next school year, okay, we're getting the things in place. Now we need to get the actions in place, so let's make sure we're having robust crisis teams. Let's take on that leadership role as the nurse on the crisis team, and doing those things and making sure, again, that we are just doing those preparedness things for things we hope we never come across, but we're prepared and we have a plan in place and we're not reactionary. We already have those things in place that people don't even, realize. We have AEDs in the district. I believe right now we're sitting at 18 total, and we're getting additional ones where we're seeing a need. We have stock Narcan. That's for, we have a opioid epidemic going on. And so in the event there was an opioid overdose, again, accidental, who knows, we have stock Narcan to save a life. We also have, in the event someone experiences an allergic reaction, whether we have stock epinephrine. And so whether the person experiences a first-time reaction in our buildings, or the person we know has an allergen, but for some reason they just don't have their pen with them, we have something that is life-saving that can help them. So a lot of things in place. Every school has crisis teams. And like I said, that our goal is just making sure those crisis teams are just more robust.
And that's been a long-standing. Every building has a crisis team. Those individuals are trained in CPR and first aid, and go through different drills just so everybody. And then I think principals do a nice job of making sure that every area of their building is covered, that they have some representative of a crisis team member, so they can respond as quickly as possible and work with that student or teacher or staff member until a school nurse gets there, or until an ambulance if that's needed.
Exactly. They have them pretty purposely spread out throughout the schools, and those are other godsends. Again, they are non-medical people who are learning a lot of medical things, and just for day-to-day stuff. And so it's really nice just having those resources.
Absolutely. So if a student takes medication, and that was another question I meant to ask. So sometimes if a student has a sore throat or something, parent thinks, you know what, I'm just going to send some Tylenol in their pocket. And so very well-meaning, but talk about, we have very specific procedures.
Yes, there's certain, there are laws and regulations. So it's not just Emporia Public Schools is making this rule. We as nurses, we have to follow orders. We have to have, whether it's doctor's orders or parental permission. So if it's an over-the-counter medication, so first and foremost, no one is allowed to carry a medication on them, even if it's Tums, Tylenol, or, their ADHD meds in the high school level. No one is allowed to carry their medication on them. It needs to be in the nurse's office. We have a few exceptions to that rule. So if there is if they have an emergency med, so if they have an EpiPen or a seizure medication or an inhaler, something of that nature, an emergency medication, and the doctor signs off, the parent signs off, then they're allowed to keep that on their person. That is the only exception to the rule. Other than that, it stays in the nurse's office and it's locked up. So kind of to your example, they have a little bit of a sore throat. One, we always ask, if you can please just check their temperature, that would be a sign of infection. And you can, and if it's above Emporia nursing standards is at 100 is when we start sending home. So if you can look into their throat, for instance, and if that doesn't look right, we nurses, we can't diagnose, we can't do anything for it. So your best bet is to call your doctor and just not take them to school that day, especially if there's a temperature. But, something very mild, and just, hey, they had a little bit upset stomach. I think Tums is the one that we always get. And then they're like, oh, no, let's get that back in the nurse's office. There is medicine in it. We don't want, it's not candy, that sort of thing. And of course, that's more the elementary level, but even up, to our high schoolers, So the rule is we have certain forms you have to sign, and you can keep the medicine at school, and that's fine. It'll just stay in the nurse's office. And if it's an over-the-counter medication, such as Tylenol, ibuprofen, Tums, and Zyrtec, things of that nature that you don't need a doctor's prescription for. The parent can sign out an over-the-counter form, and then we can keep that on file. And then usually at the elementary level, with them being younger, even though we have the form signed by the parent that says, yes, we can administer this medication, we usually still reach out to that parent, just like, hey, FYI, Johnny's feeling like this. I was going to try this. Have they had any medicine yet? Okay, no, I'm going to go ahead and give them this. They're not allowed to have any more medicine until this time. So we kind of have that communication. Even at the middle school level, at the high school level is when we get definitely way more independent. And so moms and dads and guardians really love that over-the-counter form whenever we get to the high school level, because they're like, okay, finally, I don't need to be called for ibuprofen anymore. If it is a prescription medication, that definitely needs to be locked up in the nurse's office, and it'll require a doctor's signature for it, as well as a parental signature. And if it's something that we need to give during the day, the student and parent usually always arrange, and the teacher always arrange that. They come down to the nurse's office, take their medicine, or if it's an emergency medicine, we keep those stored in our nurse's office too. And those would be quote unquote prescription medicines as well. And of course, we hope to never use them, but we have them in our nurse's office just in case.
Well, so sometimes maybe just clear up some confusion sometimes, because thinking that one, running out of medication, that's something that is maybe a student receives on a regular basis, or if the parent is running out of medication and knows there's more medication at school and would like that released, so like over the weekend. So talk a little bit about both of those situations.
Yeah. So what is required for the medicine to be in the school is it needs to be in the original packaging. So even if it's an over-the-counter medication, it still needs to be in the original bottle, so we have all the information on it. You can't just put a few in a baggie and send it over to us. Same thing with their prescription medicines. So a big one is something like their ADHD medicine. So what we ask parents to do is talk to their pharmacy, and they usually work with schools really well, and they just make 2 bottles. And so then they make 2 bottles with the same thing, and then the parent can then break up how many they need to send to school, or vice versa if we need to send some back to them. And then there's constant communication. We actually have a new health record, which is really nice. It's called SNAP, and it gives us, I think our nursing staff's pretty phenomenal, and that includes our health office aides when I say nursing staff. But we're constantly communicating with parents, letting them know when they're low. But we have this program now, and it gives us alerts whenever they're getting low. And so it's just nice,
awesome.
nice backup.
Yeah. Well, and we're talking about medications and going kind of into some in-depth, but the majority of our kids don't take medication. It's the few. So
Yes.
but sometimes there is that confusion about how medication is handled, but there are very strict procedures and confidentiality and just making sure that everything is very secure at all times.
We have to always follow our 6 rights of medication administration. So
let's see here. So talk about when students are sick and then when they come back. So that 24-hour fever-free,
Sure.
those requirements.
Yeah. So if they are sick and they are running a fever, again, Emporia nursing standards is 100 or greater, we ask for them to stay home until they're 24 hours fever-free, and that's without using medicine. So if they're needing the ibuprofen and the Tylenol to keep their fever away, then they're not fever-free. So we need them 24 hours fever-free without the use of fever-reducing medications. And then one that's also really confusing to people is like, okay, what if they're vomiting or have diarrhea or have strep throat? So strep throat, one, that's a very specific one. So it's going to have specific guidelines with their antibiotics. It's 12 to 24 hours after antibiotics and 24 hours fever-free. And then with our other GI type of ones, typically 24 hours until those symptoms have passed. And so, of course, there's always those special circumstances with GI situations. And so if you are questioning it, just call before you send it to school, and we can kind of give you more guidance. But really, it's 24 hours, even, diarrhea, not vomit free as well. If they do go to the doctor, and they get, swabbed or whatever. They do some more testing with that person, and they come find out they have some sort of infectious disease, whether it's strep throat, which I kind of hit that on, but it's, COVID or flu. Then from there, there's further guidelines we have to follow because we have a specific diagnosis. Once you're diagnosed with flu, you need to stay home for 5 days from symptom onset and be 24 hours fever-free before you come back. And COVID really is now the same rules. So COVID is kind of just another respiratory illness now. We still have to follow guidelines when someone comes down with an infectious disease, and COVID is one of those, and it has its own guidelines, and it's very similar to flu. If you're diagnosed with COVID, you stay home for 5 days from symptom onset, and then COVID just has that little caveat still when you do come back, and again, 24 hours fever-free as well as those 5 days. You just need to come back with a mask for days 6 to 10.
Well, so along these lines, is there anything on the district website as far as health services that you would like to highlight?
I love our website. So Lindell has helped me a lot get our website on just specifically on just how the health services page on how we've envisioned it. And so the health services page is really nice. So if you go to our website, you just hit menu, hit services, and it's health services. One, you'll see who your school nurse is. So that's always nice, and it has a face to their name. But it also has a section where it'll have frequently asked questions. So kind of things we just went over and kind of the explanation and the why behind it. And then we also have a spot which is wonderful for a bunch of our forms we use. And it's the forms we use district-wide. So it's our medication forms, it's physical forms, it's the CASHA physical form in English and Spanish. It's our meal modification forms. I feel like I'm missing something, but
sounds very comprehensive.
Yes, and it's very nice to have that all just like, if you go to this spot, you'll be able to find it.
Awesome, awesome. Well, yes, we love our new website also. It took a long time to get here, but it's been very
wonderful.
Very nice.
Yeah.
Well, is there anything that you'd like to add that we haven't discussed?
Man, I feel like we I think we kind of got everything in a quick little nutshell. It was kind of nice to talk about everything that the nursing staff, does do.
Yes. Well, and that's the purpose, is we're trying to highlight what's happening behind the scenes and things that maybe our parents or community members don't normally see. And so it's just a way of really just kind of giving the details. And there's a lot of work that happens every single day. And even though as a district, that director of nursing services, you're out in buildings. So you're out there helping. And if there's somebody, and if there's a school nurse that's out, I know you're out there helping and covering. So
the
really
joke around here is my office is here at Mary Herbert, but I'm never in my office. Very rarely am I in there. No, it's fun. It's fun getting a real kind of fun kind of health aspect in the schools lately. We've been doing these fun little health fairs lately. We're trying to get that expanded. Just all sorts of just ideas going, and it's been a lot of fun lately.
Good. Well, we're glad that you're here, and thank you for that important job. It really is a very important job, and our school nurses are so appreciative of it.
Well, thank you, and thanks for letting us highlight what we do.
Absolutely. We will end on our Emporia Public Schools mission statement. We engage, we empower, we inspire. Thank you for listening today, and watch for upcoming episodes.